Hi, today we will be presenting our community group project presentation. And today I have here with me
Jolene.
and myself, Jimmy. And so what is dementia? So dementia is a group of symptoms that is caused by damage or loss of nerve cells within the brain. See the picture in the center, we have a normal side of the brain, and to the right, we have a severe side of dementia of the brain. And so the early symptoms of dementia are subtle, and sometimes it may be hard to detect them early on. And some of the early signs and symptoms may include progressive and frequent memory loss, confusion, personality and behavior changes such like mood swings, apathy and withdrawal, and importantly, the loss of ability to perform everyday tasks. And as dementia progresses, a person slowly becomes unaware of who they are and will fall under the early stages, mid stages, or late stages of dementia. There are 5 types of dementia. And as you can see in the pie chart in the center, Alzheimer's is the most known and common cause of dementia, which is ranked 6th leading cause of death in the United States. It is a progressive disease leading to memory loss and impairment of the brain. We have the Lewy body dementia, which is the second most common dementia, and it affects the chemicals in the brain that leads to problem with memory and, importantly, the motor function. And then to our left corner, as you can see from the picture, you can see a little blood clot right in the vessels of the brain, and this leads to blockage and reducing of the blood flow. This involves declining thinking skills and impairs the reasoning, planning, and also the judgment. Frontal temporal dementia. This is a buildup of protein in the brain, which variably causes deterioration in behavior, personality, and importantly, comprehending language as well. And lastly, to your right, we have the Parkinson's disease dementia. This plays a key role in movement.
So some goals for the community. So reduce alcohol abuse, reduce drug abuse, and reduce depression. Alcohol and drug abuse can later on in life cause people to lead into dementia. If you're depressed early in your life, you have a 70% increased risk of dementia. Drug abuse, like in Stockton community in general, we have like we don't even have to do research on it. We've seen it all in the hospital with our own eyes, with how badly people abuse drugs and a lot of those people end up getting dementia later on in their life.
And in this slide, we have some of the prevalence facts shown here. And around 12.7 million people are age 65 and older are projected to Alzheimer's dementia by 2050. And like I said earlier from previous second slide, that Alzheimer's is the 6th leading cause of death in the United States. And almost 2/3 of Americans who has Alzheimer's are women. And also in the bottom of the slide, we also have some more facts of the prevalence of dementia, as older Black Americans are twice as more likely to have dementia compared to whites. And the other one is also older Hispanics are about 1 and 1.5 times as more likely to also have dementia. And importantly, the middle one pronounced that 6.2 million Americans age 65 and older living with Alzheimer's dementia in 2021. And as that time increases, also the prevalence of dementia will also increase.
Just to add in, this is California's Alzheimer's statistics. So the main one I want to point towards is the purple. And as you can see, right, in the year of 2020, there was 690,000 people with dementia. It's an estimated number, of course, right? And just in 5 years, it's projected to have a 21% increase. That's a huge amount of people, and it's growing. It's not like decreasing, or it's not steadily growing. It's increasing at a drastic, almost a 25% every 5 years. So this is something concerning that, like, right now, so we do need to keep an eye on it. And that was just basically the point of this slide.
What are the signs and symptoms of dementia? Well, there's a few, such as confusion, having memory loss, changes in abnormally personalities and moods, impaired judgment and misplacing items frequently, such as your keys, inability to perform activities of daily living. So someone may not be able to brush their teeth, or being able to cook or get out of bed, and decreased social interaction. What are the risk factors for dementia? Well, we have old age, such as 65 years age and up, being a woman, or more specifically, being a 65-year-old woman, injuries or concussions, or maybe cognitive impairment, using alcohol or smoking, because if you're gonna smoke, then you're gonna be affecting the lungs and diminishing your lung function, which decreases the oxygen going to your brain. And then we have family history of dementia and comorbidities such as diabetes, hypertension, and specifically depression. And how can you prevent and manage dementia? Well, first of all, is being loving and supportive as much possible. Even if you're not a healthcare provider, you should be supportive towards one another and caring, just reaching out to your loved ones. Get some early screening for any signs of cognitive impairment or get checked up for those head injuries. It's also essential to and have good nutrition and exercise. Cessation of smoking programs or alcohol rehab is great to go. Managing your health problems and challenging your brain, such as improving your neurological function, improving memory, and improving your blood flow to your brain, such as maybe reading a book or doing puzzles.
Health resources and the benefits of these health resources. So, for example, you have these 24/7 helplines or hotlines, right, that you can call, and the number's right there. And basically, you can call them. And the benefit of this is that you have help whenever you need it. You don't need to go anywhere, and it's whenever you need it. And you have home healthcare services, and you have some in Stockton, such as Pacific Home Care, Home Instead, and Infinity Care. These are all Stockton-based, and these basically allow for someone that's like dependent on someone, like it needs a caregiver, and basically allows for them to have a caregiver. So it's kind of sort of like a sniff, but not really, but mainly it helps with dementia patients, right? And then you have health insurance. This is going to help to cover the cost of dementia. There's some health insurance such as Delta Health Systems, Raj insurance systems. These are insurance that you can use. There's many other types of insurances that we haven't talked about yet, but these are just some. Then you have cognitive diagnostic testing, which is psychological based. It's mainly like you're doing interviews with the patient, you're doing questionnaires and tests. And they're used to determine if someone has dementia or a type of dementia, such as Alzheimer's. Then you have educational resources, such as, we have the World Wide Web to use, internet, and we have some education resources that we can give is diet and exercise, because having good nutrition and good supplementation can allow for decrease in dementia exacerbation later on in life in that case. And then we have adult protective services, and this is mainly related to elder abuse, since again, people that have dementia are more likely to be older and they're more likely to be dependent. So if they're dependent, we have to be careful that the person that's taking care of them, the caregiver, is not abusive towards them. And there have been cases of elder abuse, so that's why you have adult protective services. And the Dameron Hospital, which is where our clinical was at, they have case managers to keep an eye on why are these patients coming in, were they abused or not, kind of looking at the warning signs. And again, this protects from elder abuse. Healthy People 2020. So, I mean, these are just a rundown of some of the goals. And Healthy People 2020 just wants to reduce, the morbidity and cost associated with dementia, because these people are going through a lot of it's a new disease still. Like, it's not new, but still, like, they're figuring out how to deal with it, and there's a lot of costs associated with it. And along with that, they're dependent. So these are just some goals, such as increasing the availability of diagnostic tools that we talked about previously, so getting diagnosed easier, decrease the number of people that are undiagnosed. So again, that has to go with testing, right? Making sure we test people for when they have their checkups, or after the age of 65, start getting checkups for dementia. Reducing severity of behavioral or cognitive and behavioral symptoms through medical management, which means medications. There's no cure for dementia. And that's the thing. That's the research we need, is to figure out, is there a cure? Is there a way we can fix these issues of dementia that's so common and becoming more prevalent? And having family members and people are supportive of the people with dementia, not abandoning them or abusing them, because even emotionally abusing them can really hurt them, but they're still humans. And encouraging healthy behaviors that we talked about, nutrition-wise, and brain exercise as well, like doing quizzes, crossword puzzles, things like that. So I mean, this is just a reflection of what I felt, and then Jeline felt, and Jimmy felt. So I'll just talk about what I felt. And I was doing some research, and we figured out that there's actually some famous people with dementia that we didn't even know that had it. For example, why am I not thinking of the president? Which I have it right here. So it's the president, Ronald Reagan, and he was the 40th president, and he's known, and he's a very popular president. You know, people liked him a lot. I mean, some people might not like him, but he was a popular president, and he had dementia, you know? And I don't think a lot of people know that he had it. We have civil rights leader Rosa Parks. Again, we're taught about this all during elementary and middle school about the civil rights movement. And we see how we always knew that she was the one that kind of rose up and allowed for the boycott to happen, but she also had dementia. And then we talk about a famous actor that everyone loves, you know? I knew him because of Miss Doubtfire, but there's also people that knew him because of Jumanji and stuff. And he had also dementia, and he had a sad end to his life too. And we don't know if it's a result of dementia or not, but he did have dementia. And so just my main thing is that dementia can affect anyone, and it's just very scary that it can affect anyone. That's my.
Okay, so what I learned from this project is that you have to be loving and supportive to one another, especially your elderly adults. So making sure you reach out to maybe your grandparents, maybe even just your parents, or just reaching out to anyone in general, because you don't know what they're going through. That's because they put on a smile on the outside doesn't mean they're okay in the inside. So it's okay. So make sure to reach out and talk to people you haven't seen in a while, and also make sure to take care of your mental and physical health, because you're important too and you deserve to be loved. So if you need to talk about your feelings, reach out to someone. Yeah. Next.
So what I put is one person caring about another represents life's greatest value. And just working respite care in the previous years, I understand how crucial it is for people to need people. And the ones going through dementia definitely not only affects themselves, but affects their family, and affects the caregivers. It also affects the community as well. And there's been this big stigma in people going through dementia of just being isolated, and also having this way of being neglected. And also that's importantly in our part not being aware, and also being educated about it too. And what I put here really emphasize that despite what a person may go through through dementia, you know, they are still someone's dad, they are still someone's mom. Importantly, they are still themselves, and that's a part that, you know, we, not just the healthcare team or medical professions, but everyone not from that background could still show compassion, could still show awareness to the prevalence and the incidence of people going through dementia. And because importantly, you know, we never know when that state will come, but we definitely know how to show love and our support, and just being curious about it too, and also knowing ways to just continue to spread just the awareness of dementia, and how we could continue to not increase the incidence, but definitely lower the rate of incidence for dementia. And so this one signifies important motto for just dementia and Alzheimer's in all. So thank you.